How to use a known sperm donor for fertility. Using a known sperm donor for fertility can be an exciting journey, but it involves several important steps to ensure everything goes smoothly. First, the donor needs to undergo a thorough medical and psychological screening. This screening checks for overall health, genetic suitability, and the absence of infectious diseases. It usually includes genetic tests, infectious disease panels, and a detailed medical and social history questionnaire. Sometimes, additional tests like color vision or urinalysis may be required. Once the donor is cleared, they will provide sperm samples, which are then processed and cryopreserved, meaning they are frozen for future use. When it comes to using the donor sperm for fertility treatment, there are several methods available. The prepared sperm can be used in procedures like intrauterine insemination, intracervical insemination, or in vitro fertilization. Intrauterine insemination is a common and less invasive option. In this method, sperm is placed directly into the uterus around the time of ovulation. Intracervical insemination involves placing sperm at the cervix and can sometimes even be done at home. In vitro fertilization is a more complex procedure where eggs are fertilized with donor sperm in a lab before transferring the embryos to the uterus. This method is often recommended when there are significant fertility challenges. Legal and emotional considerations are also essential when using a known donor. It is highly recommended to have a legally binding agreement in place. This agreement should clearly define parental rights, responsibilities, and expectations for everyone involved. Having this contract notarized and ideally drafted with legal counsel can help prevent future disputes. Additionally, it is beneficial to engage in counseling or psychoeducational sessions with a mental health professional who specializes in third-party reproduction. This support can help address any emotional complexities for both the donor and the intended parents. For individuals or couples facing fertility challenges related to endometriosis, using a known sperm donor can be a valuable option. Endometriosis can impact natural conception, and assisted reproductive technologies like intrauterine insemination or in vitro fertilization with donor sperm may enhance the chances of pregnancy. Medical teams typically tailor the fertility treatment plan based on the severity of endometriosis and the overall reproductive health of the female partner. To summarize, here are the key steps to using a known sperm donor for fertility. Ensure the donor completes thorough medical and psychological screening. Process and freeze sperm samples for future use. Choose an appropriate insemination method based on fertility factors. Establish legal agreements that clarify parental rights and responsibilities. Engage in counseling to support emotional well-being, and work closely with fertility specialists to create a personalized treatment plan, especially when managing conditions like endometriosis. This comprehensive approach balances medical safety, legal protection, and emotional support, optimizing the chances of a healthy pregnancy and a positive family building experience.